You're watching ACC Update on CardioSource Video News.
Coming up, we'll explain the role of accountable care organizations, ACOs, and why the ACC is urging an innovative approach to this new concept. We'll also take a focused look at the Women's Health Program, find out what ACC is doing to reduce gender disparities in care. And later in this program, we'll be joined by ACC's Vice President of Science and Quality, Dr. Janet Wright. She'll tell us about ACC's initiatives in the quality care arena, including steps the ACC has taken to address the Department of Health and Human Services' national strategy for healthcare quality.
From the American College of Cardiology in Washington, D.C., this is ACC Update.
Welcome to this edition of the ACC Update for November. I'm Lisa Fletcher. Our top story, accountable care organizations, or ACOs, as defined under the nation's new health reform law, offer opportunities for innovation and experimentation, or at least they should. That's the premise of the ACC's recent comment letter sent to the Centers for Medicaid and Medicare Services. While the obvious arrangement for an ACO resembles today's integrated health systems, the ACC is urging CMS and others to give individuals and organizations interested in the ACO concept wide latitude to take risks and experiment with new payment models. How wide the latitude was a subject tackled during a special day-long workshop in October. The ACC participated on 2 panels moderated by the Federal Trade Commission that looked at methods of clinical integration. The ACC will continue to work with CMS, the FTC, and others as this issue evolves. ACC recently welcomed a new international chapter to its 39,000-member-strong organization. The ACC Executive Committee has recommended Saudi Arabia for chapter status, which will make that country the 8th ACC international chapter, joining Brazil, China, Israel, Turkey, Germany, Malaysia, and the UK-Ireland. The ACC's international chapters offer leadership and networking opportunities and allow members to discuss cardiology issues in their home countries.
The ACC is working with all its international chapters to identify opportunities for educational partnerships, registry development, and collaboration around research and quality initiatives.
Despite an increased push in promoting healthy habits, more than 35% of American women are overweight. Another 25% smoke, and 1 in 5 have some form of heart disease. This year's Heart of Women's Health program is focused on addressing these issues and finding ways to reduce gender disparities in care. It will also educate attendees about heart health, nutrition, and the latest guidelines.
So because of the increase in the prevalence of these risk factors, we know that in the coming years, the epidemic of cardiovascular disease and the mortality from that is due to have actually an upswing.
The Heart of Women's Health program is co-sponsored by CREDO, the Coalition to Reduce Racial and Ethnic Disparities in CV Outcomes. It will take place January 21st and 22nd in Washington, D.C. Registration is open now at cardiosource.org. As the healthcare landscape continues to change, the next generation of cardiovascular leaders will be key to shaping the future of CV practice. To that end, the ACC's Cardiovascular Leadership Institute, or CLI, is arming cardiovascular professionals with crucial leadership skills necessary to represent the interests of cardiology in areas such as hospital integration and women in cardiology.
The CLI was able to react to that very rapidly by developing training programs to help our members see what their options were in practice other than spiraling down difficult avenues financially.
The Evolving Models of Cardiovascular Practice Symposiums are just a few of the live educational programs offered by the CLI. Special sessions are also planned for ACC 11. When we return, we'll be joined by Dr. Janet Wright, ACC's Vice President of Science and Quality, to learn more about ACC's involvement in the quality care arena. Stay with us.
The ACC is your cardio source. Visit us at booth number 351 to find out about lifelong learning, science and quality, advocacy and practice management, and the Member Center. Don't miss CardioSource video news coverage of AHA Scientific Sessions 2010. Our team of experts will be at the desk and on floor to bring you science and announcements from the meeting, including daily news and headlines, one-on-one interviews with investigators and newsmakers, discussion and analysis from our expert panel, and more. Keep up with it all on cardiosource.org. It's the next best thing to being there.
Welcome back. I'm pleased to be joined by Dr. Janet Wright, ACC's Vice President of Science and Quality. Dr. Wright, thanks for being here.
My pleasure.
ACC is very involved in quality care and recently provided some important feedback to the Department of Health and Human Services. Why don't you talk about that a little bit?
I'd love to. We were privileged to provide feedback to the Secretary on the National Quality Agenda. And I think the reason we were asked to provide that input is that ACC is recognized as a leader in this area. We have registries with over 11 million patient records. We have national quality improvement campaigns like Door to Balloon and Hospital to Home, and are beginning to use electronic information or health information technology to connect doctors and nurses and help them accelerate their learning and disseminate the programs that are effective.
And this new health reform law offers a lot of opportunities for the college to really shape how quality is measured. Is that part of it, all of those examples that you just gave?
Absolutely. We are absolutely committed to getting the measurement of performance right and then being able to reflect performance in a way that aligns with payment. We think that high-performing practices and doctors and hospitals are more valuable to the system and to their patients and should be reimbursed that way.
How do you get the measurement right? How does ACC do something that nobody else knows how to do?
Well, actually through combined efforts. There are experts out there, many of whom are our members, and then we have an expert staff to help perfect the art and the science and then be able to reflect performance back to folks.
Talk about some of the ACC initiatives that are underway within your department, the Science and Quality Division, that will help CV professionals really prepare for this new future.
Right. Probably the fundamental one is the concept of registries. That is, submitting data on your patients and then learning from that aggregate data on where the gaps in care are, and then we have programs to help practitioners close those gaps.
ACC over the last several years has said that patients' own involvement is really key to quality care. So how is the college incorporating that and incorporating those sorts of trends?
Yeah, probably the most effective way will be through CardioSmart, our patient-facing website. We have a number of ways to help practitioners and patients begin to manage chronic conditions more effectively. Getting at behavior change is challenging, and we're developing some expertise in that area.
So getting patients to make their own care a priority helps change their behavior along the way?
Absolutely.
Dr. Wright, thanks so much for joining us today.
I enjoyed it.
Really appreciate it. And join us next month for all the latest news and updates from your college. I'm Lisa Fletcher. Thanks for joining us.